Pix 11 Morning News.
Lynn, every 40 seconds, we want you to take a serious moment with this. Every 40 seconds, someone in the U.S. has a stroke, and every 4 minutes, someone dies from one.
Yeah, this morning we're learning the truth about the disease. Cardiologist Dennis Goodman from NYU Langone joining us to dispel a few myths about strokes. Good morning to you.
Good morning, Corey.
So first of all, just lay it out. What is a stroke?
So a stroke is a heart attack of the brain. People understand a heart attack where there's a blood clot, there's not enough blood flow to the heart, and you start losing heart muscle. This is the same thing, but it occurs in the blood vessels to the brain. There are two types of stroke. There's a ischemic stroke where there's a blood clot that blocks flow to the brain, or a hemorrhagic stroke where there's a bleed in the brain. So it's a heart attack of the brain.
All right, so and is there a difference or a correlation between stroke and heat stroke?
Very interesting. They really don't have anything to do with each other, in the sense that the risk factors for a stroke are not the same as heat stroke. Heat stroke's about prolonged exposure to high temperatures associated with dehydration. Summer's coming now. People need to avoid that. So you can get a stroke because of high temperatures and dehydration, but that's because of low blood pressure, lack of perfusion to the brain.
So that is a misnomer, and that is a myth.
One has nothing to do with the other in terms of risk for stroke.
All right, so let's play it. Myth versus fact.
Yeah, myth number one, a lot of people think strokes only affect the elderly.
So, Corey, that's not true. There are 800,000 people having a stroke every year, 1/3 less than age 65.
All right, so who's at risk more, men, women?
Men are more at risk.
Okay, and any ethnic groups that are higher?
The black population is at higher risk. One of the reasons is a high incidence of hypertension.
Okay.
High blood pressure.
All right, let's talk about the next myth. We're talking about this. Strokes are rare. Fact or myth?
Strokes are not rare. 800,000 strokes a year. 1 in 5 people die of a stroke. And cardiovascular disease includes the heart and the brain. And this is something that I always mention. When people die of a heart attack, 50% of them, it's their first and last symptom. That's a heart attack. And so stroke we're the same risk factors for heart attack and stroke. You want to do prevention. It's so important that you know what your risk factors are.
People don't realize that you can prevent a heart attack, you can also prevent a stroke as well. So that's very important. Another myth is that there's no treatment for strokes.
Now that's a real myth. And I just want to bring out to the audience, I want them to think of this word FAST, F-A-S-T. If you're with anybody who seems to have a facial droop, something happens where there's asymmetry of the face, that's the F. The A is for arm. They can't move their arm. There's weakness in the arm. The S is for speech. Ask them to say a simple sentence. The sky is blue. Where's the dog? Anything like that, and they can't do it, call 911. It's absolutely crucial that if you get to the hospital in 3 hours, we can actually save a life and prevent a lot of brain damage. So there are ways that we can do that. One is to give a blood thinner that can get rid of the clot, and the other one is actually to a mechanical advice to get the thrombus, the little blood clot, out of the brain.
So strokes can be prevented, and up to 80% of strokes are preventable, and that is the good news, and that's what we need to be aware of.
Can we just make one more point? Don't take aspirin. Very important, because people think with a heart attack you take aspirin, it's going to help save your life. It's not like that with a brain, because 20%, 1 in 5 strokes are from a bleed in the brain. You don't know until you get to the hospital. You have to have a CAT scan. All
right. Dr. Goodman, thank you so much. Always great information. He also has a book. It's called Vitamin K2. And we're going to have a link on that for our website and how you can get those additional resources on strokes. Make sure to visit us at pix11.com and click on the Morning News tab. You can also check out Dr. Goodman's book, Vitamin K2, the missing nutrient for heart and bone health.
We'll be right back.